Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe our channel if you have not, and if you will see the latest results of OET, listening has really become a matter of concern. When it comes to listening part A, it is very important to secure at least 20 to 22 marks from part A. So if you are filling your exam, then this is the perfect thing. If you are scoring at least 20 to 22 marks in the part A, then you are all good to take your OET exam. So I'm just gonna solve a listening part A and also would like to tell you how you can practice listening. See, when it comes to practicing listening, it's very simple. You simply go on YouTube. Simple. Just make it as simple. You don't need PDF or anything. Nothing. You don't need anything. Even if you do not have laptop, go on your mobile phone. You know, open your YouTube app. Go to this search window and say OET listening. Simply write this way, and whatever listening comes your way, if you want to check out this one, if you want to do something other, that is not a matter of concern. Just practice as much as you can
Occupational English
when it
test.
comes to listening part A. So today, before we start this session, so as I was guided that we should do this listening of Elizabeth, so I just wrote Elizabeth OET listening, open this listening. It's that simple it is. So you don't have to even do when I'm do anything else. Just you can open on your mobile phone. You can simply put the headphones if you're traveling in the bus, if you are washing dishes, if you're doing household chores. Even then you can do listening just on your mobile phone. That is how easy it is. Please do not try to find a very secure place to do listening part A. Listening part A can be done if you are a healthcare worker in UK, you are traveling, or in New Zealand you are traveling. If you're not driving yourself, you can simply do that very nicely. So I'm just going to play this listening, whatever it is. So this test has got questions before you hear. This test has got three parts. You will hear number of difference. At the start of each extract, you will hear a beep. You will have time to read the questions before you hear each extract. The most important instruction about the OET listening, you will not get any extra time at the end. So please try to write very nicely, very clearly. You will not get any time in the end. Normally we get 2 minutes, but don't consider that 2 minutes. You have to write nicely, increase your speed, and you normally have to write 2 to 3 words. So make it very simple. So I don't know whether this listening is easy or difficult. I'm going to do that in front of you, and here it is. You will have time to read the questions. So what do you need to do? At the end of the test, you will get 2 minutes. That's what I'm saying. You don't have to even consider that. Each extract, and you'll as you listen. Okay. Part A. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. That is what I am saying. Out of 24, if you can secure 20 to 22 marks, it's like a wow thing. So practice as much as listening of part A to learn more spellings, to learn more things. And again, simply go on YouTube, write OET listening, do whatever listening you want to do. So I'm just going to take it further. It's 1 to 12. The notes. So this is the time. You will get some seconds. I don't know whether it is 60 or 90 seconds. But first of all, what you need to understand, when the listening is when they are not speaking anything, in that time you need to understand the topic. So I'm just going to go through this topic. This topic is about Elizabeth Campbell, referral to dash, health nurse, pain in the back. So I can understand the topic now. There is pain in the back. Experience discomfort and dash. So obviously there would be a symptom. Use pain relief ointment. So I will fill a symptom over here. Referral to public health nurse, community health nurse, it can be anything. Pain in the back. So treatment history, pain started 1.5 years ago, was dash a painkiller, was prescribed a painkiller, was commenced on a painkiller, something like this will come. So I can speculate, I can guess the words which can come. And OET listening is especially matter of concern for doctors, for senior doctors, and for nurses as well. So please do not take it lightly. It's very important part. So was now I can make passive voices. Was prescribed on a painkiller, was commenced. So I'm expecting a third form to be here. Okay, hospitalized for 2 days, underwent blood test and dash test. So there must be some investigation test. So I can fill in that test. So I can already speculate that patient has come for pain. and patient is having multiple symptoms, discomfort and dash in the back, then was prescribed, then 6 months ago, 12 months ago, 6 months ago dash was found. These words are very important 6 months ago because these are the referral words. These are the reference points. Suppose if I miss one blank, then as soon as that person says 6 months ago, I understand, oh my god, my fourth question is gone. So you need to, sometimes you miss couple of blanks in a row because you do not know where that person is speaking, what that person is speaking. So in that case, it's very important to read these headings. 6 months ago dash was found, surgery to remove a dash of the bone. It can be tumor of the bone, surgery to remove a chunk of the bone. It can be anything, but you can actually speculate. Of word, a word is very important. These are articles, prepositions. These words play a huge role. You have to notice all these words. Recent pain control dash times a day. Dash times a day, there must be some therapy 3 times a day, some medication 3 times a day. There must be something like that. Alternative modality of smokes dash dop. Mental status seems dash and anxious. So seems stress, seems depressed and anxious because of tumor. So tumor word is here. So I can see it can fit in remove a tumor of the bone or something like that. So by chance tumor word is there. So my speculation is going fine. I don't know what exactly would be the word, but that is how you guess. This is very important to make you feel secure. So seems depressed and anxious, considered dash because of the bouts of depression. So depression word is there, so I'm expecting depressed as well. So this is how good you can become, because I am thinking about an active word. Seems stressed, seems depressed, seems distressed, something like that. An active word would come. So I have that thing that we should know what kind of a plan. Assessment and follow-up, arrange for dash alternative therapies. Yeah, arrange for follow-up, maybe something like that. So let's play it. And now so within these 30, 60 or 90 seconds, whatever it is, I should understand the topic. So I can understand the topic. My topic is about pain. My topic is about treatment. History, my topic is about 12 months ago what happened, then 6 months ago what happened, recent pain control what happened, mental status of the patient, and the assessment and follow-up. Let's see.
Hello, Elizabeth. I'm Richard. I'm one of the nurses in this district nursing, and the doctor has asked me to see you, so I guess you know that.
I am a nursing in a district nursing. So most probably if I do not listen any particular word, then referral to district health nurse. I will play it again for you. This is how small the margin is. That is why you need to be attentive and you need to be there. I'm going to play again for you. Okay. Just feel happy that you're doing something good, you're learning something. So don't take your listening as a challenge, take your listening as a part of learning, reading as a part of learning. It's very important to have that positive mindset. So please keep your mind positive. Let's play.
Hello, Elizabeth. I'm Richard. I'm one of the nurses in this district nursing, and the doctor has asked me to see you, so I guess you know that. Yes, I do. All right, yeah. So please take a seat. Thank you. Right, yeah. So, how can I help you? Um, well, nurse, it's kind of a bit complicated. I've got this problem with my back. All right.
And now I am focusing on the word when she will say pain, when she will say discomfort. As soon as she says pain or discomfort, I will immediately fill district. By that time, I am waiting. Otherwise, it's now almost 90% sure that it should be district health nurse. But still, I am not filling the blank at the moment because I am focusing on this word, experience discomfort and dash in the back. So I'm waiting for this thing.
Hurts very bad. All right, yeah. I've seen your case notes, and yes, I've seen that, yes. So, can you explain the situation you go through currently? Yes, sure. I experienced this discomfort and a very stiff feeling in my back. It's been.
Now, see, this is the word which can be missed very easily if you are not doing listenings on a regular basis. So this word is district, spelling should be right, district. Then experience discomfort. and very stiff. And now if I fill very stiff, it is not a nice blank to fill. So if I understand this blank, it should be experienced discomfort and stiffness. That is the better word I would like to fill. Discomfort and stiffness. So I will, this is my responsibility to change this stiff word into stiffness, even if by chance the answer is not given stiffness, but still I would like to feel stiffness. That I am telling you, that is your responsibility to do that. I will again play it for you, because that is what I need to make you understand.
It's kind of bit complicated. I've got this problem with my back. All right. And it hurts very bad. All right, yeah. I've seen your case notes, and yes, I've seen that, yes. So, can you explain the situation you go through currently? Yes, sure. I experienced this discomfort and a very stiff feeling in my back. It's been long.
Now I can listen, very stiff feeling. Now this can fill in. Let us try to fill experience discomfort and very stiff feeling in the back. So this is a better word, very stiff feeling in the back. Then in is my preposition. So I can feel, I can write discomfort and very stiff feeling or stiff feeling in the back. So now I will not write stiffness. I will write stiff feeling. Stiff feeling is the blank that should be filled. Again, I will play a little for you. So, can you explain the situation you go through currently? Yes, sure. I experienced this discomfort and a very stiff feeling in my back. It's been long. So, feeling in is my preposition, stiff feeling in the back, or otherwise I will feel stiffness in the back. So these are the only two probabilities I have: stiff feeling or stiffness. And better is to write very stiff feeling. These are the three words I have heard. So I will fill very stiff feeling. All the spelling right. Very, STIFFEELING. So this is very important. I know it's boring when I'm teaching you this way, but this is how specific you should be if you all want to pass when it comes to listening. Let's go to other questions. Now I will try to increase the speed. Right. And I used to use some pain relief ointments to relieve the symptoms, but lately it's not working. All right, yeah. So, can you tell me when this started? It was 1.5 years ago when the pain started. All right. I was prescribed with some painkillers back then. All right, yeah. Prescribed painkillers then. Again, as expected, it had to be prescribed. So that is what I am saying. Having a speculation can help you a lot. There are only two words she has spoken: started and prescribed. So I would better go with was prescribed, because it is a passive voice. That means was prescribed a painkiller by a doctor. So that is where I always tell you that active and passive should be well known to you. So active means when you are using the second form. Passive means when it is done by someone. Like in the OET writing in the past, we say medication was prescribed, medication was commenced. So maybe you are filling the word prescribe over here, then it is wrong, because you have not made the right passive voice. So was prescribed a painkiller. It should be third form. So that is what passive means. Okay, done. And after 12 months, there was no relief in the pain. All right. So you have been taking the medicines consistently. All right. Yes, yeah. Okay. Well, I could not stand up. Oh, okay. Right. For which I was later hospitalized for, say, 2 days. Okay. And I underwent some blood tests along with the barium meal. Oh, yeah. All right. Yeah, that's right. Along with the barium meal test. This is the word when I started teaching OET. Even after started teaching OET, even in the next 5 years, I never read this word barium meal. But you are nurses, you are doctors, you are well familiar with this word. I am a dentist. I do not had knowledge. I did not have knowledge about barium meal test. But now this is why I am saying in the listening part, you practice as much listenings as you can. In part B and C, you need to repeat listenings. That is the difference. Part B and C repeat one listening 3 times. Part A, do one listening 2 times and keep on doing as many as you want. So that is the difference in the part A and part B in both reading and listening. Do as many as reading part A, do as many as listening part A. But part B and C, try to learn again and again from this part B. Please try to do the same. I know it's boring, but try to do the same to get the best. Now let's go further. Barium meal test. So that is also done. See if it had been your exam. So there are two blanks which were easier. First one was easy. Otherwise, first one was also little tricky, but second, third, and fourth, all blanks were little tricky. So you need to practice them to become better. You can't keep on saying, oh, I cannot understand, I can't do that. This will not help you to pass OET. You have to work hard on your skills and you have to devote time. So please don't keep on saying, kindly try to practice as much as you can. So now jumping on to the fifth one, dash was found. Again, it's a passive voice. So something was found by the doctor, was found. Let's see what was found.
Yeah.
So later, after 6 months, I was diagnosed with a tumor in my back.
All right.
Tumor was found. I was diagnosed, passive voice, tumor was found. So my speculation was all correct. And trust me, this is what I have learned with experience. Again, I don't think I have ever done this part A. Still, I know that these are the blanks which can come. So it will help you when you will have more knowledge about OET listenings. Do not do listening just for the sake of doing, but also sake of gaining education. So that when something like the same kind of an exam come, you already like e-cigarettes. You should know about e-cigarettes. You should try to do as many listenings to gain more knowledge about it. These all instructions are very important and please try to take them very nicely.
Okay.
For which I underwent a surgery,
Mhm.
and a small part of my bone that was removed.
Okay.
So small part of the bone, small part is the word that will come here. So tumor which I was suspecting or expecting in the sixth has come in fifth, and surgery to remove a small part of the bone, it comes in the sixth.
That's what was told to me. And I was also told the tumor was spread to my liver and
right.
my lower back. And now that was very sad, and I was worried about it.
Right. So you said you were in terrible pain. Were you given some medicine for that?
Yes, I was. Pethidine 3 times per day.
Mhm.
Now this is the problem. I cannot understand the medication. And this is what OET says. When it comes to the brand name of the medications, when it comes to the name of the diseases which are on particular person, like Addison's, Crohn's disease, these Alzheimer's disease, these are on the name of persons. So these spelling mistakes will not be deducted. But at least the pronunciation seems to be same, should be same. So like this, cathedin or whatever, if I did not listen to it one time, I would write Cathedine. So that is what I will do with this blank because I did not understand. But this way I will get marks because this is the brand name of the drug. But still, I would like to listen it again just for the convenience.
That, and I was worried about it.
Right. So you said you were in terrible pain. Were you given some medicine for that?
Yes, I was. Pethidine 3 times per day.
Pethidine or cathedine, I still cannot understand pethidine or cathedine, but you will get marks for it. Again, in this blank you will get marks, but rest of the spelling stiff, no, you cannot do wrong. Barium meal, you cannot do wrong. This was found tumor, you cannot do wrong. Surgery to remove a small part, you cannot do wrong. So you have to be very specific about these things. So this spelling will be allowed to be wrong because it is a brand name of the drug.
And some alternative modalities for pain relief. I tried acupuncture for, say, 2 months, which I discontinued later.
Oh, so you felt that was not working?
Yeah, it was not.
And did you do something else for the pain?
Yes, I did, and I am still doing it. I smoke marijuana.
Marijuana?
Yeah.
Marijuana. Now this spelling can also should not be wrong. Please understand marijuana. Mariajuana. Now, these are the common terms which you should know. That is why I'm saying when it comes to part A, practice as much as you can, guys, as much as to learn more and more of spellings. So when you do listening, part A should be right for everyone except if you have learned the spellings. You have to practice that, guys. You can't, again, it's not a bad thing to practice more. So again, now I am expecting a negative word over here. Let's see.
Okay. So that's not the ideal thing you should be doing.
I understand, but
Right, yes. So, what are your thoughts about what you're going through?
that's the main reason I've come to you.
Right, yeah.
I've been depressed for quite a long time and I've been going through this rough phase. And I feel anxious about my illness. Even I get this weird thoughts of ending my life. I considered suicide.
I'm sorry.
So consider suicide, suicid, depressed word I already filled because I was expecting it. That is why I am saying this common sense, like district health nurse, I was expecting community health nurse, but it came out to be district health nurse. So these are the blanks which you can already think of. Discomfort, pain word could have been there, but it was stiff. And then, seems depressed, distressed, seems stressed, something like this I was expecting. Considered suicide I did not have in mind, but now when I find something like this in the future, consider dash because of depression, so I will always try to feel consider suicide. So I will be keen to listen to this word. So yeah, so that is how listening becomes better. Let's see 11th and 12th.
Yeah, that.
Yes, yeah, but I just want to get this over.
Right, yes.
I need help.
Yeah, but Elizabeth, that's not the way out actually.
I know.
Say, wanted to see you because, there are a couple of things that the doctor wanted me to discuss with you.
Okay.
And I would be arranging some counseling sessions for you.
That would be great.
That also I was not expecting. Arrange for counseling sessions. COUNSELL or single L, both are correct because one is American, one is British. So counseling session, SESSION. So that is how you should know this. That is how the listening will improve. Please work on your spellings.
So if that's fine with you, I can get that rolling in a few days.
Don't only learn the spellings of the blanks, but when you do listenings, try to notice other spellings like discomfort, ointments, anxious, acupressure. Now, normally I believe that acupressure should have 2C. I don't know, maybe over here it's written right or wrong, but I will try to learn these spellings too. It's not only your blanks, you learn from other listenings about different spellings. So that is how keen you should be learn. Like bouts word is a common word. Bout means episode. Bout means episodes of depression. So bouts of depression. So this word you should know medically. Sometimes you have to fill this word only, bouts of depression. So you will not understand what is bouts. Bouts is like episodes of depression. So now acupuncture, acupressure.
Yes, of course.
And that's actually part of an ongoing modalities that the doctor wants for you.
Okay.
Right. And I can also try, some alternative modalities of pain relief.
Okay.
All right. And that would include many things, including acupuncture, acupressure, and yoga.
That is how thing happen. You relax in between. You cannot stay, alarmed in the whole of your listening. You should know the blanks you want to wait for. So I wait for these things nicely, and as soon as the person says acupuncture, I come closer to, means I become more focused to understand that word, and it comes out to be yoga.
I haven't tried it yet.
Right.
Will it be?
Yes, it has helped many people.
Okay.
So this is how you do listening part A. This is Dr. Bhupesh, and you can check out the listening answers at the end. Okay, I will do it for you if you want me, because even I am a kind of a person, I do not want to judge myself. I want to improve myself. Even if I do not see answers, it doesn't change anything for me because I'm not keen to know about. Obviously, I want to know the answers, but I'm keen to learn. So that should be the first intention when you are preparing for OET. It's about whether you have heard any blank. It's not about checking out the answer if you could not find like pethidine and cathidine. I really want to know. But first of all, I would like to listen to it again before I check the answer so that my ears become adaptive to it. I don't want to judge myself. I want to be more adaptive. So cathidine or pethidine, I would still love to hear again and again if I'm practicing so that I can understand that accent. So that is what is important. Now let's check the answer. District, stiff filling, prescribed, barium meal, tumor, small port, pethidine. That's okay, but you will get the marks again. Mary Joanna again was right. Spelled I did. Fine, depressed, suicide I did. Counseling session, yoga. All are correct. That is how to fetch marks. This is how simple it is. Please do not put undue pressure. If you are not practicing, you will feel like undue pressure on yourself. So please do not put undue pressure on yourself. And these days, listening all of a sudden has become a part of a challenge. Reading done, writing done, speaking done, listening. No, guys, listening is the easiest. It's just because you are not practicing it. You need to practice it, and this is Dr. Bhupesh from Dr. BKM Institute. Please subscribe our channel if you have not. Our contact number is 76967 34256. Thank you.